rate of something called lobular breast cancer, also known as invasive lobular carcinoma, has increased dramatically during a recent 10-year period. This is according to the American Cancer Society. That's a steeper rise than all other kinds of breast cancer combined. So we want to learn about what this is and what it means for all of us. Let's bring in Dr. Payal Kohli, adjunct professor at both Johns Hopkins University and Duke University. Doctor, thanks so much for being here. So what is invasive lobular carcinoma?
Good morning, and such an important topic. I don't think we can talk about it enough because we really are seeing a shift with more cancers in young people. So the breast tissue has two types of tissues. One is the lobules and the other is the duct. The lobules make the milk and the ducts carry the milk to the nipple. So we're commonly used to hearing about invasive ductal carcinoma, which is the most common type of breast cancer, but the lobules are actually the second most common type of cancer. So the invasive lobular cancer is more common than we think, and that rate has really been increasing. And the tricky thing about this type of cancer is that it doesn't grow in a lump. So instead of forming a mass that you can actually feel, sometimes women just feel fullness in the breast. They just feel a little bit of tenderness. Sometimes they can feel just changes in the skin or the texture of the breast because it forms more in a straight line rather than a lump.
So we understand the incidence of this cancer, doctor, increased, just under 3% per year between 2012 and 2021. Did the doctors who did this study understand what's going on or why this is happening?
Well, we think we have some clues. So this type of cancer is very sensitive to hormones because, again, remember, it's the milk-producing glands in the breast that are affected. And we've seen a sharp rate of increase in hormones in women. And what we saw was that after hormone replacement therapy got a bad reputation, especially in postmenopausal women, the rates of these cancer went down. But now we're seeing especially younger premenopausal women using birth control pills, usually a combination of estrogen and progesterone, which can feed this type of cancer. Now, that combined with the fact that we're getting a little better at detecting cancer, but also combined with the fact that more women are obese and more women drink alcohol than ever before, these are all factors that drive estrogen production because fat drives estrogen. Alcohol affects the way that our body makes estrogen as well. So that's why we think the rates of these cancers may be going up, especially in the younger women.
How serious is it? What's the survival rate and the treatment as well?
So the tricky thing about this cancer is if you catch it early, it's actually better than the ductal carcinoma, that more common type of breast cancer. But the problem is that it has a high rate of late recurrence because it's often picked up much later. So again, because you don't feel that mass, and even on mammogram, it doesn't always show up. So the detection rate on mammogram, because it doesn't cause a discrete mass, is only 68% as compared to 80 or 90% for those invasive ductal carcinomas. So we really sometimes need additional imaging technologies like ultrasounds or MRIs, especially in the 50% of women that have dense breasts. So for 50% of us, the mammogram is looking for white on white, which is very hard to pick up. So you really do need a second imaging modality. So most women really need to sit down and think about their breast cancer risk and talk to their doctor if they've had a mammogram about what their breast density is, because that's how you know what your breast density is once you've had a mammogram. It doesn't have to do with how skinny you are, how heavy you are, how big your breasts are. None of that affects your breast density.
So is there a particular group that is most at risk for this lobular breast cancer?
You know, we do see some epidemiological trends, and it generally tends to be white women that are the highest risk. Obviously, postmenopausal women, because age is one of the biggest risk factors. But as we discussed, it's even going up in premenopausal women. But if you're a postmenopausal woman who is obese or has a higher body mass index or BMI, this is really someone that has a target sign on them. So I would encourage every woman to take time this month to think about her personal breast cancer risk. Go online, there's a calculator, it's a breast cancer risk calculator. You type in your numbers, it tells you your lifetime risk of getting breast cancer. And that can really help guide sort of screening and management. But you know, breast cancer awareness is so important because it is one of those cancers that we're seeing an increase in. And we do need to be thoughtful about how we use hormones as women, rather than just starting our young women on birth control pills without thinking about their lifetime impact.
Dr. Payal Kohli, thank you very much. We really appreciate always your expertise and alerting us to something like this. We'll see you soon.